Good afternoon and welcome to the ABC15 Town Hall on coronavirus in Arizona. I'm ABC15 investigator Melissa Blasius, and I'll be your host as we discuss the issues about coronavirus and its spread in our state with some of the state's top experts. These include Dr. Rafael Fonseca from Mayo Clinic. Thanks for joining us, Doctor.
Thank you.
And then we have Will Humble, Executive Director of the Arizona Public Health Association and a former state health director. And finally, Professor Joe Jarrell from the University of Arizona, who's doing a weekly forecast about the spread of coronavirus in Arizona. Let's start with the hot topic of the day, and that's cities and towns are now able to decide whether or not to mandate masks in their communities. Doctor, let's start with you. Dr. Fonseca, what is the importance of masks? Should everyone really be wearing them in public? And do they actually prevent the spread of coronavirus?
Yeah, thank you. First of all, thank you for the opportunity. It's a pleasure to be here with you today. I think the answer is a resounding yes. So the empirical evidence suggests the use of masks decreases, even if it doesn't completely eliminate the likelihood that we will see transmission. So I personally have been quite vocal and a supporter of the idea of wearing masks in public. And the reason is not necessarily to protect yourself. When people look at the mask, they think, is it good enough to prevent the virus from coming my way? But more so that we as a community prevent our outbound contamination of the community. That is, so if someone were to be infected and they don't know it yet, and they cough and they sneeze, the reach of that, we believe is going to be shortened by the use of masks. So I think it's a wise thing to do, no matter what you're told. And I think it's a good practice for individuals to do that, because we as a community can help reduce very significantly the rate of transmission of the virus.
And Dr. Fonseca, let me ask you this. We've been hearing some of the questions today surround people who have health issues. They might have breathing trouble, asthma, COPD. In one case, a lady says that she has panic attacks, and wearing that mask to them seems overly restrictive or inappropriate due to their medical situations. Are there some people who should not be wearing masks? And how do you identify those?
I think those are all first statements. First of all, if someone has enough of a breathing difficulty to start with, that wearing a mask will be hard on them, I would say they have to be extra careful, because the consequences, of course, of getting infected will be more problematic. And you can see how individuals with, again, pulmonary problems that have difficulty breathing, or even individuals who feel incredibly claustrophobic would not be willing or able to do this. But the reality is, I think the majority of the population can do this. The masks have a track record of being safe, and the kind of masks that most of the community, would use are not the very restrictive ones, like the ones we use in hospitals, like the N95s. So I would say yes, it's an individual decision in that regard, but for the most part, the majority of people should be able to wear a mask.
Okay, thank you. I wanted to get to a question that's probably our most predominant question. This one comes by email today from Samantha. With cases rising and many schools in Arizona about to start in the next 6 weeks or so, is it safe at this point to put our kids back into school? And what kinds of health safety measures should they be taking, or that we should be watching out for? And let me address this to Will Humble, because you're probably the policy guy in the group.
Yeah, so good. First of all, thanks for the opportunity and good question. So here's the thing. I think it's a good thing that the school systems are thinking about the plans to go forward and start classes this fall in the event that it becomes possible. And the real key, I think, is developing the kinds of mitigation measures within the entire, both of the school system and within each individual school, so that you can open as safely as you possibly can. And as you mentioned, it's a few weeks away right now. I think it's good that they're planning. But I think these are going to be really difficult calls, I think, for people on the governing boards of the school districts, because, on one hand, they're weighing the benefits that kids get from being in school, the social aspects, the learning components, all the other things that schools provide. And they also need to weigh that against, what are the risks for spreading the virus even further than it is? And so these are not easy decisions. I don't have a single answer for the folks in those governing boards, except stay tuned, make sure that we track the data carefully. A lot can change, as we've seen in the last 3 weeks. A lot has changed for the worse in Arizona. If that trend continues, and if the modeling, like Dr. Jarrell has been working on, ends up being correct, although we have done some mitigation measures now in the last 24 hours, so that may have an impact. If the models that we're showing today continue along the lines that they are, I don't see how you can safely do it, no matter what the mitigation measures are. But again, remains to be seen what things are looking like in another month.
Mm-hmm. Well, one of the issues with putting students back in school is that if people are returning to work, is there a safe place that you can put your child while you're at work? Does this also extend to daycare? Lots of parents are making those decisions about whether or not they feel it's safe to put their child in a daycare situation. Let me hear from a couple of the other panelists. I mean, what would be your advice to parents who are saying, I need a safe place to put my child during the day while I go back to work?
Yeah, and so I'll chime in a bit there. And also, thank you for having me today. It really asks us to reframe our notion of what is safe. And for public health professionals, we can divide that roughly into kind of two ways of thinking. One is what's safe for the individual. And so for the children themselves in schools, fortunately, the coronavirus represents a fairly low risk to them. It's not no risk, but it's certainly low risk. And transmission within those groups is not so much a threat to them, but rather those around them, bringing the virus home to parents, grandparents, uncles who aren't in the same situation, who are going to be older at greater risk and also may have comorbid abilities. And so it's a challenge. And as Will Humble said, these aren't going to be easy decisions. And it's a very fluid situation. The circumstances that we face today may be very different from the circumstances that we face in August. And so I think we have to be prepared to constantly reassess where we are and what we should be doing.
Okay.
Maybe I can compliment what Joe said. I think he really presents it very, very clearly. And one word that caught my eye is humble. The reality is this is a evolving situation. And I think we know that everyone would want to have the precise answers of what are the best things to do. We have some good indications as we talk with the masks. But I think when one thinks of this from a perspective of public health, it is impossible to know 100% what the right decision is in some of the situations. So I think no matter what, people have to remain smart, but then we all have to be humble and understand that not the full set of answers is out there at this moment.
Let's talk a little bit about comorbidities, and maybe this is a good question for Dr. Fonseca as well. First of all, we mentioned this a lot when we talk about coronavirus and people with comorbidities, but people don't really understand what comorbidities are. Can you explain what they are, and if you have one of these, what extra precautions you might be wanting to take?
Of course. So comorbidities is just a medical mouthful to talk about a number of other health conditions that individuals can have that would put them at the risk of having a worse outcome with a number of conditions. In this case, if you were infected, a comorbidity would be that which you carry as a health problem in the past that then would put you at a greater risk. And as some of the data sets have come forward with the analysis of what is it that puts someone at risk, it's kind of the things we would all expect, of course, individuals who have pre-existing conditions like obesity, diabetes, hypertension, heart disease, severe pulmonary problems. Those are going to have a much harder time dealing with the consequences of the infection. And the reality is that we're facing an infection that seems to be quite intense, far more intense than what we normally see with viral infections. So if you have a person who has any of those, and by the way, that person also is debilitated for other reasons, or that person has an advanced age, it's going to be harder for their body to overcome the effects of the infection on the body. And if you look at the data from what we're seeing for serious infections and unfortunately mortality associated with COVID, it all really focuses on that, on having medical conditions that would make a person already be handicapped in some way as they're facing the possibility of infection, and then overcoming that becomes more difficult. So that's what we mean by comorbidities, and the ones I mentioned are some of the principal ones we're seeing in the series regarding the more serious outcomes for COVID.
Thank you, Doctor. And if you're just joining us on Facebook or YouTube, this is the ABC15 virtual town hall on coronavirus in Arizona. I'm your host, Melissa Blasius. I'm joined by a panel of experts, Dr. Rafael Fonseca from Mayo Clinic, Will Humble, the Executive Director of the Arizona Public Health Association, and Professor Joe Jarrell of the University of Arizona, who does a weekly report about the spread of coronavirus in Arizona. We just talked about people with comorbidities. Let's talk a little bit about younger Arizonans, people who are in their 20s and 30s, late teens, people who we've seen out at the bars in Scottsdale and in Tempe in large groups. In talking with some of these people, they feel like if they get coronavirus, it might be a very mild or asymptomatic case. And so they're not very worried about it, and they're going on living their lives without taking many of the precautions that public health experts are recommending. How does this affect the greater community, I guess, is the first question. And the second question is, what do you say to someone who thinks, I'm young, I'm healthy, I'm going to be fine? Will Humble.
Yeah, I mean, essentially, that kind of behavior just amplifies the virus. And I think Dr. Jarrell mentioned it. Well, both of our other, everybody's been mentioning it here about how the importance of the fact that people who are at lower risk, like the people you just described, people in their 20s, are amplifying the virus, and it puts more virus into the community. And there are more opportunities for that virus to then find somebody who is more susceptible to the more serious aspects of this disease. And so, for example, one of the things that catches my eye is, those people we see in downtown Scottsdale at the clubs on those weekend nights. How many of them? Some of them might work in assisted living or skilled nursing facilities. Undoubtedly, some of them have parents or grandparents who are higher risk in the community that they see on weekends or other times during the week. And so, as they become infected with the virus with that kind of behavior, it just adds more virus into the community and puts those folks that are at higher risk at risk for more complications, jeopardizing the capacity of the healthcare system, which is the thing that we all have been trying to avoid the whole time.
And Professor Jarrell, you've been looking probably most closely at the numbers. Are we seeing a growing number of these young people contracting the virus, testing positive, and possibly being hospitalized at this point?
And so it's an interesting question you asked. We've been thinking about one of the interesting things we've observed in the data, which is the case counts have been rising much faster than hospitalizations. And so we were curious as to what might explain that. And our working hypothesis right now is that the age of the individuals who are testing positive in Arizona has dropped considerably over the past 6 weeks. And so in early April, the average age of someone testing positive for coronavirus was about 50. Today, it's less than 40. And, I think it's aligns with some of the behavioral things that we've been observing, in that working age adults are rejoining the economy and re-engaging. And so there are more opportunities for them to contract the illness. And it's possible that individuals who are older or those who are at risk for some reason are electing to stay at home and minimize their opportunity to become infected. And so the answer is yes, I do believe more younger people are becoming infected. There is a change in the way the outbreak is unfolding. But again, low risk doesn't mean no risk. And so I just looked at the data before joining the call. For those aged 20 to 29 who get coronavirus, who are confirmed, right, they've had a test, 3.7% will end up being hospitalized. And of those, 0.1% will end up dying from coronavirus. Of course, these numbers overstate the risk a little bit because there are many people with coronavirus that we never know about because their symptoms are so mild. But again, just to reinforce, at a population level, there are a lot of young people out there. And even if only a small number have these serious consequences, in total, it adds up over time. And so low risk is not no risk.
Okay. Let me get to this, to one of the questions from our Facebook viewers. And you can submit your comment or question below, and we'll try to get to as many as we can. This one's from Dwayne Winborn, and he's concerned about these very large groups at the protests and the spread there. Do we have an idea, Dr. Fonseca? Do we have an idea of how many people are getting the virus this way? And being in those group protests, could there be a lot of spread that way?
Yeah, to the best of my knowledge, I have no data. Perhaps the other panelists can comment. The reality is, no matter what your activity is, whether it's related to the protest or something else, I think distancing is important, and that applies as well to gatherings and going out. So my short answer would be, I don't know what the data is, but in general, no matter what your activities, it's good to keep some distance as one of the key aspects of prevention, and we've seen that very clearly from the CDC.
Okay.
So I have something. Yeah, I can add something to that. So it's for sure that kind of behavior is amplifying the virus. That is a way that the virus can spread. There is emerging evidence that this is a preprint, so it's not in the peer-reviewed literature yet, but a study from Japan showed that outdoor environments are 17 times less likely to spread the virus than an indoor environment. And many of the protesters are wearing masks. I'm not saying that the behavior doesn't spread the virus, but if you compare that to what we see on weekends, with the clubbing behavior, I think that's a better opportunity. That's a bigger risk for spreading the virus than the outdoor protests, given the data that I've been seeing.
Okay, and let me talk a little bit about that. The governor did address some of these groups yesterday. He has put in the Arizona Department of Health Services has put out new guidance for restaurants and bars in order to up the public health precautions happening at those places. He did, though, address there's going to be a Donald Trump rally later this week. Actually next week, and there was some question about how can you allow these kinds of large-scale events to go on, and he said that people have a right to assemble, and he said especially in an election year, right? So some of that has to do with rights to free assembly and free speech, right?
Yeah.
Okay.
Yeah.
We all kind of nodded our head a little bit, like yes.
Throw a little hot potato in there, and nobody's going to grab that one. Certainly, our public health quarantine isolation laws restricting public activity, they do involve trade-offs and balances between competing rights. And so those decisions are not easy to make. I would amplify what Will Humble said is that, we think the greatest risk come from large gatherings in indoor enclosed spaces where people are in very close approximation and they're not wearing masks. And that's the biggest risk. Certainly the question comes down to, as we've seen in the protest, the right to protest, the right to free assembly. When does that infringe upon other rights and the right to safety? And so difficult decisions, but we do know that's a very risky behavior. And so as public health professionals, we would advise against it.
Okay. Let's talk a little bit about, I know the CDC recently put out some additional guidance for people about what are less risky behaviors or activities and more risky places to go. Give me some examples of those that are safer activities versus less safe activities, and what are the factors there? Will, if you want to start.
Okay, so I haven't seen the guidance that you're talking about, but so I'll just speak from my background on this. I would say you start with the two main ingredients, which is number one, if the activity is outside, that's better than inside. If the participants have some distance between them, preferably at least 6 feet, that's better than activities that don't have 6 feet. If the people are wearing masks, that's a lot better than people that are not wearing masks. And so I look at each of those things as a layer of protection. And so none of them individually are going to end up, stopping the spread of this virus. Even collectively, that won't happen. But if you add layers, distance, masks, hand washing, outdoors, if you add, the more layers you add of protection, the more we mitigate the spread of the virus. And so that's the way I think of it, is each of these things are a layer of protection, and the more layers we add on, the better it is.
Okay. So let me ask you this. This is an interesting question, and I hadn't seen it before. Charles, who emailed us, is asking about fans and misters in some of these outdoor eating environments. Could those help spread the virus or maybe cut down the virus? Dr. Fonseca.
It's hard to know. And I think once you start thinking about all the variables of how the virus could travel, you start asking yourself those questions. I would probably go to the basics. I think it's logical that if you were in proximity to someone and perhaps you have a fan, maybe, it's easier for particles to travel that way. The reality is everything that is done, both with the masks as well as with the distance, you just want to try to minimize the distance that the droplets can travel from a person who's infected and from their body to the next person. So, the reality is I get questions like this every day, and it's very, very hard to tease out specifically each one of them. Do you sit, downwind or upwind of someone? What is the effect of the tone of the voice or the volume of your voice as you're speaking? If people are singing, things that perhaps would promote more dissemination of some of these particles. I mean, it's going to be very hard to have research that addresses all of these questions. Perhaps I would just summarize it, stay smart. And I think if you're in an area where there's enough distance and there's some misters, as we frequently see here in Arizona, that are helping out, maybe I wouldn't consider that necessarily a very high risk situation.
And let me just add, if you're comparing let me just say, if I had a choice at a restaurant of being inside with other customers or being in an outside environment and using the misters to make it habitable, I'd take the outside misters before the indoor dining.
Okay. Thanks, Will. If you're just joining us, this is the ABC15 Town Hall on coronavirus in Arizona. I'm Melissa Blasius. We're joined by a panel of experts, Dr. Rafael Fonseca from Mayo Clinic, Will Humble, Executive Director of the Arizona Public Health Association, and Professor Joe Jarrell of the University of Arizona, who does a weekly report talking about the forecast for coronavirus in Arizona. Let's get to one of our Facebook comments here. Veronica Castro is talking about the hospitals possibly getting overwhelmed. And they're there now, she thinks. Those of us who have been cautious with their safety and security, they're worried about healthcare because of people who aren't following some of these guidelines. So let me ask you, Dr. Fonseca, what is it looking like at your hospital or other hospitals as you're talking to other medical professionals? Are they full, first of all?
Thank you. Well, first of all, let's start by what we said before. The numbers are going in the wrong direction, and we need to be very objective and very cautious as we look at these numbers, because downstream from those new number of cases, there could be a greater number of hospitalizations and a greater number of bed utilization. So my hospital, like all other hospitals, both in the Valley and the state, very closely monitor a number of things. They monitor our total occupancy. They monitor the total number of patients that are admitted with either suspected or confirmed COVID. We monitor the number of patients that are in intensive care unit, and of those, how many of those are requiring ventilatory support. As of now, we still have the capacity in the hospitals to care for what's happening today. I guess the concern just comes from the number of new cases that have been reported and the rate of new positive cases. And we have to factor into that, of course, what kind of cases are being seen. I think, as was mentioned previously by Joe, we've seen a greater number of positive cases than necessarily what we have seen in the uptick in number of cases hospitalized, which I think, in my opinion, would be a better metric because it tells you more about those serious cases as opposed to the ones that may occur in less symptomatic individuals, particularly the younger. It is worth noting that everyone in the state and among the hospitals are coordinating the efforts, and there is some added capacity that is possible should it be flexed in the way of providing more capacity to the hospitals throughout the state. That is not anything that is required at this moment, but of course we're following the numbers with a lot of attention at this point.
And Professor Jarrell, I know you've been doing some forecasting on this.
And so I would add to a little bit different points there. And so I agree with Dr. Fonseca's comments. one thing is to think about, do we have capacity to care for COVID-19 patients? And I agree, yes, at the current time we do. And so there are two challenges of thinking ahead. What capacity will we have in the future? And it's been repeatedly mentioned, the trends aren't in the right direction now. And so we are seeing a decline in our safety margin for additional beds. And that safety margin, looking at current trends, is going to run out sometime in July. And then we'll have to transition over to what is called surge beds. These are beds that can be made available, but they're not normally in routine use. And they may not offer the same level and type of care that we would normally provide. And then the second thing is to think about all of those patients who have conditions that are not coronavirus and the care that they might need. And so the more care that we provide for coronavirus, the less care that's available for elective surgeries. And, thinking about someone who has maybe osteoarthritis of the knee or the hip, and they've been waiting for, a joint replacement, that's considered elective. If you ask them, they probably wouldn't view it the same way. It's certainly not a life or death issue, but if we think about quality of life, if our capacity doesn't meet a certain standard, say 20% capacity remaining, then these elective procedures have to be put on hold. And that causes consequences and ripple effects, not only for those who have coronavirus, but those who have other medical conditions that need care.
And Melissa, I just want to add one more thing to that. Joe, they had good points, both of them. But here's one thing I want to really emphasize, which is that often we talk about licensed capacity, licensed beds. Well, a licensed bed is different from a staffed bed. A bed is just a bed. You need staff to care for patients in order for it to be of any use at all. And so one of the things that I'm particularly concerned about is as we erode our safety margin more and more, it puts us at greater risk of not being able to staff beds. Maybe you could have a facility can open as a surge facility, but if you can't staff it with qualified people, it's not really effective. And so that's why I have been so forceful at trying to get some mitigation measures in place, which fortunately the governor at his press conference yesterday agreed to many of the things that a lot of stakeholders have been asking for. And we're hopeful that in combination, those set of interventions will make a difference and buy us a little bit of extra safety that we didn't have 2 days ago before those decisions. So I think those have been really important decisions, and it's going to be really critical for the cities to step up and take that role upon themselves around masking requirements and other mitigation measures at bars, restaurants, and other big gathering places, because those are going to take time to have an effect. And so I want to emphasize the importance of what happened yesterday. That was a big deal. And Dr. Jarrell, you're going to have a hard time at your next analysis. You're going to have to, we're going to have to change the input parameters because now we have some different interventions in place that will hopefully make a difference and slow the spread of this virus compared to what we've been seeing with essentially very little interventions ever since the May 15th.
If I could complement that too as well, I think we've seen a lot of the press coverage across the nation for what's going on in Arizona, and there is no doubt we're all concerned. We want the numbers to go in the opposite direction from where they're going right now. What we need, though, is to focus our energy on those measures that will reduce the transmission of the virus, and I think that's where the messaging is more important, perhaps even more so in the alarm of the beds, but it's really enhancing those behaviors that will decrease the transmission of the virus, as we have been talking during this show. And I think that's where the public can make a big difference in what happens over the next several weeks and months.
Okay. Let me ask this question. It comes from Feline Sokol. What has been the recovery rate? We hear this from a lot of people. They want to know why can't they easily find a coronavirus recovery rate? What is the rate? And then let me ask you this: if you've recovered, is it something as simple as you've recovered from a common cold, or are there lasting possible health effects?
Yeah, so maybe I can take that one. The reality is it's a whole spectrum on how the recovery has occurred for people. We believe when you look at the very large numbers that most people recover and go back to their normal lives and their normal function. However, there is no question that there are individuals who have long-lasting effects from the virus in the lung tissue because of some of the inflammation and how long it lasts in the lungs. to the point that in some individuals, it has been quite limiting in their ability to be able to re-engage in normal life with very significant decreases in their pulmonary function. And it's worth remembering that when a person is that sick, there could be other organs affected as well, too, as a consequence of the whole system undergoing such inflammation. So there could be other lasting effects. But if you take the numbers at large, in general, most people recover and come back to normal from what we can tell right now.
And let me throw a little other question in here, maybe for the statistician amongst us, Professor Jarrell. People have talked about this not being as serious as even the flu. More people die of the flu than this, or they talk about those statistics. Are those holding true at this point? When we look at death rates over just a 3-month period of time or so?
No, they're not. So there's clear evidence that coronavirus infection is much more severe and lethal than even severe influenza seasons. There's still debate on what the exact multiplier is, how you would scale that up, but there's no question it's several times more serious or severe than our typical influenza numbers. And so we know that with a high degree of certainty.
Okay. And just if you're still joining us, this is the ABC15 Town Hall on coronavirus in Arizona. I'm investigator Melissa Blasius, your host, and we're joined by Dr. Rafael Fonseca from Mayo Clinic, Will Humble, the executive director of the Arizona Public Health Association, and Professor Joe Jarrell of the University of Arizona, who does a weekly report on the spread of coronavirus in our state. We are going to take a few more questions. If you do have some more questions, put them in the comments section on our Facebook page, and we will try to get to some more of them as soon as possible. We talked earlier about what happens with the students in elementary school. We have to remember that we have some very large universities here. And people are thinking about sending their students back to college in the fall and how that might look. Are the universities prepared to accept people back onto college campuses? And what preparations are you seeing from your perspective? Let me ask, Professor Jarrell, have you been working on any of that over at U of A?
Yes. And so there are a lot of people at the University of Arizona and ASU and all of our colleges who are thinking very carefully about this. We're putting in place a broad array of mitigation measures, trying to think through what testing strategies and resources might be available to do the traditional things that we do in public health, identify cases, trace contacts, and then isolate those who are infected. I think one of the things that I worry about is many of these reopening stratagems were really predicated on a respite that we were expecting over the summer, where case counts were going to decline to quote unquote kind of manageable levels. But instead, what we're seeing is a ramp up of cases right before we might be going back to school in mid to late August. And, it's a very different situation than if we were dealing with a relatively low number of cases. And so this is going to put a lot of strain on our universities. And so are we prepared? Again, it kind of comes back to the notion of safe. And there are two concepts there. What's safe for the individual students? Fortunately, most are young and healthy, and they're going to manage a coronavirus infection very well. But as Will Humble indicated, their infections pose a risk to the rest of us, to faculty, to parents and others, family members, people in the community. And so whose safety we're really trying to prioritize in these decisions, and decisions become more difficult.
And Dr. Fonseca, you've also been working on this issue a little bit. Anything to add here?
Sure, thank you. I think we face similar issues. We have a very strong partnership with Arizona State University to try to assist in the process of coming back to school in the fall. So we have been working with the Office of President Crow to provide some assistance and consulting regarding the best practices. We actually publicly announced a partnership in this regard that would include the capacity to do testing and some advice regarding behaviors and best practices as the students return in the fall. I think many of the education institutions are looking at options that would allow either a hybrid or a temporary ability to join activities remotely and electronically. And I think particularly for a university as ASU that has students that come from all over the world, this is going to be an important step for them. So I think just like what you've heard from Joe, all the large universities are mindful of the implications for their student body, but also, which is critically important, for the faculty, other employees, who generally will be at an age greater than that of the students, and for whom the risk would be greater.
Okay, let's go to another question. Thank you for that, Doctor. From Krista Leone. She says, funny how they said this virus doesn't last long in the heat, and yet here we are. Today we had more than 2,500 newly reported cases, according to ADHS, as they're getting these testing results back. What about the summer effect? What happened to that? Anybody?
Well, I think in large part it was wishful thinking. It's a brand new virus. If you think back to March or April, as May approached here in Arizona, we became, I think, one of the first places globally that had the kind of combination of really high temperature and low humidities, so we could test to see whether this virus would slow down with our really hot weather. And so I think many of us were hoping that there would be a seasonal effect, like there is with influenza. Well, as it turns out, there's really no evidence that there's a seasonal effect that I can see. I haven't seen any papers that have been published. There was one preprint that suggested maybe there would be a seasonal effect, but I think we were all hoping that the weather would be an intervention in and of itself, but it appears like no such luck.
Just if I could add to that, we have here the effect of influenza, and part of this, it's thought to be a contributing factor, people go indoors. So there is no data for this, but a hypothesis, perhaps, as we're seeing, hotter temperatures, could it be that has somehow made people be closer to each other as we approach this? So I think, regardless, one should not assume that the heat of Arizona is going to take over the virus. I agree, it was totally wishful thinking, and many of us would hope that would have been the case. It's not, from what we're seeing. But second of all, if you must be indoors, then again, follow the safety behaviors, because there is a possibility that this could be contributing in that way.
Okay, thank you. Here's another question from Judith. I hope I'm saying that right. Nunez. What is the average of people that are testing positive for COVID and self-quarantining but don't become symptomatic? Is there a chance they can become symptomatic after quarantine? So this sounds like a question for people who have had an exposure possibly to someone with coronavirus, and what should they be doing? And maybe this is a question for Will.
I think let's give this to Joe, I think.
Okay. Yeah. And so there's been a lot of debate around what is the asymptomatic fraction. And it seems to be large, that there may be 40, 50% or more individuals who develop coronavirus infection and don't really know it and can't recognize it from something that's different. Of course, there's another large group that develops infection and they are able to spread the virus before they themselves have symptoms, but ultimately they will go on to develop symptoms as well. And so the short answer is we don't know with enough precision as we would like, but there are a lot of individuals who become infected, more than half likely, who don't know it, never know it. And we as public health professionals don't know it either, because we just don't know to test them. And so it's a real problem, because although these individuals seem to transmit to others at a lower rate, there's still enough transmission that it's something that contributes to the overall burden.
Thanks, Professor Jarrell. Let me ask Will Humble a slightly different question now, which is, tell me about contact tracing. Does it work? And is this a possible way to start containing the virus and reducing the number of new cases?
Yeah, so it's one of the tools that we have. So we've talked about a few of them already today. Mask wearing in public spaces, especially indoors, mitigation measure, distancing, physical distancing, avoiding large crowds, especially indoors. Those are all mitigation measures that work to slow the spread of the virus. Contact tracing is another one of those. So it's a tried and true public health measure it's actually been, we've been doing it since the 1800s, really. You identify cases, look for their contacts, give advice to the person who's infected with the virus to go into isolation, encourage their contacts to go into quarantine, which is to stay away from others to the extent possible for 14 days. That's an effective public health tool. It's not a silver bullet. It's not something that's going to end the spread of this virus. But like masks, it's an important public health mitigation measure that can help slow the spread of the virus and save lives. And so it's an important tool. It's labor intensive and it's costly. And I think it's something to point out, I think, where we talked about masks at the top of this telecast. Let's look at the return on investment. So if you look at the return on investment for a mask wearing requirement, it's off the charts. Think about it. The cost is essentially nothing. The cost of a bandana for $1. I mean, the price of mask wearing is so low compared to the payoff. Contact tracing it's labor intensive, it's costly. There's a big payoff to it. It has a high return on investment because it's proven to be effective at slowing the spread of the virus. But it's costly and it takes time to ramp up. And the county health departments in Arizona are doing that now. They're hiring people all the time. Maricopa County just led a $10 million contract crisis response network for this kind of activity. So it's an important measure. It works, but it needs to work in tandem with the other measures that we've already talked about today.
Okay. And then Dr. Fonseca, I'm going to give you the last word here about, as a medical doctor, what is your best advice to your patients who come in who are concerned about getting the virus?
Thank you. Well, I would say twofold. There's things we know and we should do, and we've talked extensively about that during this town hall, including prevention. As of now, the best tool is prevention, and I think we should do our part to make the transmission go down, and ultimately we will be able to control this. I have no doubt about that. On the other side, please know that the medical field is working ferociously to find solutions with regards to treatments, ultimately things such as vaccines that will help and will make this be under control. We don't have the answers right now. In my professional career, I have never seen a time where people have come together so fast to provide answers to a problem as what we're facing here. Under normal circumstances, sometimes it takes more time to either write a grant or schedule a meeting to decide on a medical thing, where we're seeing now in a period of 2 and 3 months, people coming together, developing clinical trials, developing papers and publishing those papers. And the medical community is committed not only to do its part as it comes down for the care of current patients, but also to find those solutions for the future.
All right. Well, I would like to thank all of you, Dr. Rafael Fonseca, Will Humble, and Professor Joe Jarrell for joining us today for this town hall on coronavirus in Arizona. I hope that if you've been listening in for the last 45 minutes or so, that you have gotten a lot of good information that you can take home and you can share. In addition, if you do want to see this video in its entirety, we will be posting it on abc15.com/town hall. Again, gentlemen, thank you so much for joining us today, and stay safe and healthy.
Thank you. My pleasure.
Thank you.